Good morning. It is Thursday, September 2nd. Welcome into the Morning Medical Update. Coming up today as we head into another long holiday weekend, remember what Dr. Stites always says, the rules of infection prevention follow you wherever you go. He is here to share some of his words, plus Amanda Cackler, Director of Infection Prevention and Control, is here today to tell us what we all can do to help protect ourselves this Labor Day weekend. Plus, we're going to hear from Chelsea Smith with the Community Blood Center as our area is in desperate need of blood donations. But first, as always, Dr. Dana Hawkins joining us with our numbers. Good morning to you.
Hi, how are you?
Hi.
So first of all, start off with Hayes. They have 14, 12 are active, 2 in that recovery period. But quickly want to transition here to the health system. We have 93 total patients. 54 of those are active, with 16 in the ICU, 10 on the ventilator. So again, a large proportion on the ventilator. 39 are in that recovery period, a total of 93, like I said. We have 13 of 54 of those active patients are fully vaccinated. So that's about 24%. However, it should be noted that many of these patients are currently eligible for third dosing, meaning they are immunosuppressed. And on September 1st, we did have 2 deaths during that day, and both of those patients were unvaccinated as well.
All right, we're going to get to reporter questions. I want everyone to know Dr. Stites is sitting right here next to me. How are you? Good morning.
I'm good, thank you. How are you?
I'm good.
So, some interesting stuff coming out last night.
Okay.
First of all, podcast, New England Journal of Medicine. It's free and open to the public, I've been saying that for a while, but really good, smart folks, nice discussions, really pointed to a couple of key things. First, they're a little more reserved about who all is going to get that third booster, and really focused on immunosuppression and age, as Hawkeye and I were talking earlier this morning. And the second thing they really said, look, vaccination, what is it meant to do? What is your goal of vaccination? And we've had to shift a little bit, let's be honest. With the alpha strain or with the original strain, vaccination helped reduce disease transmission. With the Delta variant, what it really does is it focuses on reducing death and severe outcomes. And so I think what we have to accept is vaccines remain highly effective against death from Delta, but it doesn't do as much for disease transmission. In saying that, though, another study out yesterday in Lancet Infectious Disease, and I have to read the actual study. I've only read the summary of the study so far. But interesting in what it pointed out is that it looks like vaccination does reduce the risk of transmission. It doesn't eliminate it. And we want to return to that point. But what it also does is it cuts the risk of long haul syndrome by over half. So that's pretty good data. I think another thing we need to focus on, Hawk, is that, long haul syndrome is really bad. And if you can get the risk of that, that's another reason to get vaccinated.
Yeah, I would agree, and that's for all ages. I think that was very well said. We were looking for some of this data, and this was a question that has come up over the past few weeks. You and I both know that, so I think that's encouraging data signals, and we'll keep looking for more as well.
So there's a graph I wanted to point out to here. This is a report that came out in the last couple of days, and it looked at how Delta variant and how the coronavirus works in general. And one of the things that you want to do, of course, is to be vaccinated. And one of the reasons to be vaccinated is because it helps prevent severe disease. It may reduce transmission. It reduces long haul syndrome. In this curve, look at one important point, that this is a reuse of the 3 vaccinations. And we've asked the questions, asked of the day, do we think that the FDA approval of a drug has made a difference? And what you see in this is that there is an uptick in Pfizer. There's a little bit of a rise in Moderna. J&J kind of steadily falling. But look at that uptick in Pfizer, suggesting that, as it got closer to the FDA approval and has been approved, that we're seeing more and more people wanting the FDA, wanting Pfizer as a vaccination. So just something we want to pay attention to. This is a graph of looking at how infections are going in your area, and it looks on it on August the 31st, and you can see in it that there's the dark green representing well-vaccinated areas and the light green not well-vaccinated. You can see there's a lot of light green in the Midwest and in the South. And go to the next one. Yeah, this is the graph of the hot spots, and you can see how the number of how those hot spots really mimic where the lack of vaccination is, right? We've been saying that all along. So, vaccination probably does reduce some disease transmission because we can see it in these graphs. Now, if you look at this is a graph of risk areas. And what's interesting is if you look at it back around July the 10th or 15th, I think, you can see with the purple area, again, it started in Springfield, Missouri with the Delta variant and where it spread. Now look at how the Delta variant has such high risk areas. That is, the risk is defined by the rate of rise of community transmission and the number of unvaccinated people. Look at the amount of purple that's overwhelming that map.
And before we get that question, explain Nebraska to us, please, because people are going to wonder.
Nebraska doesn't report their data by county, and this map is constructed by county. And so they have a lot of counties with under 20,000 people in them, and so they don't report that data. So
do they need to get with the program? Or
yeah,
is it...
I wish, but they I don't know, they haven't all along. The counties that are shown are the more popular.
Okay, we always get that question when you pop that map up. It's very telling.
It's just how Nebraska reports, so anyway.
Do we have some reporter questions on the line? Okay, so go ahead and get your community questions coming in. And Amanda Cackler, she's working. She's coming in here in just a little bit.
Yeah. It's like there's sick people out there or something.
Right? It's like you guys have jobs. It's crazy. So, but let's bring in our other guest today. We have Chelsea Smith. She is the Outreach Community Coordinator with the Community Blood Center. And welcome. Good morning to you. How are you?
I gotta unmute. I'm great. Thank you guys for having me back. I appreciate it.
Welcome back, Chelsea.
Yeah, good to see you. So I want to talk to you, first of all, just run the numbers for us as far as blood donations go.
Yeah, unfortunately, we have, over the past couple of weeks, have reached emergency levels with our local blood supply. As you know, we've been in a shortage throughout the entirety of the pandemic, but we haven't been quite this low. So we are sitting at about a 2 to 3 day supply overall, with a half day to 1 day supply in our O types. It's going up just a little bit since Monday. We did go live with our blood emergency on Monday, but we're not really seeing the turnaround that we need to see as quickly as we need to see it.
And now we're going to do a holiday weekend. That's got to be concerning as well, right?
Absolutely. We are still continuing to struggle with our seasonal shortages that we always see. So holidays, summer months, winter months. We saw blood shortages during those times pre-pandemic. So now we're experiencing some of that. But in addition to those typical concerns, we have the added concern of the Delta variant and the cases that are spiking in our area, which is absolutely impacting our blood supply right now.
And Chelsea, we've been talking with you throughout this entire pandemic. This has just been a trend. It's just generally been low, and it's been a struggle to get people to come in and donate for all sorts of reasons. One of them is due to concerns over safety. So lay that to rest. How safe is it to donate blood right now?
It's safe. We're saying the same thing that we were saying at the beginning of this pandemic. And actually, 18 months into this, we have yet to have a COVID outbreak that can be traced back to a donor center or a blood drive. That is because we are doing our due diligence to maintain safety here. All donors and staff are wearing masks in all of our facilities across the community. We are testing we're testing the blood for normal bloodborne pathogens, which does not include COVID, but rest assured that you don't have to worry about bloodborne pathogens either. Also checking temps at the door. We're making sure that people aren't presenting sick, or if they have tested positive for COVID, we are asking them to wait that time frame before they come in to make sure that it's still safe for other people to donate. Enhanced disinfecting, social distancing at all locations, that all remains in place. So concerns surrounding COVID, though they're understood, they're not necessary in our facilities. We are making sure that they're safe places for you to donate.
I've been down to your center. You guys are doing it right. I always felt very safe down there. So, Dr. Stites, I want you to jump in on this conversation too. But Chelsea, just how does this affect our entire community when our blood supplies run low? It affects the community, hospitals, patients. What are you hearing from your partners?
Yeah, it definitely impacts our local hospitals. And during a time when their resources are already strained due to the COVID outbreak, this is just an added strain to the public health care crisis that's already happening. So when we saw what we saw at the beginning of the pandemic was elective surgeries were canceled. Things were postponed. Routine care was postponed so that we could handle the COVID cases that were coming in. However, now, 18 months into this, I think that our hospitals have grown used to it, unfortunately. And so you're able to handle COVID cases as they come in, but also handle routine care and surgeries. So what we're seeing now is very, very low donations, which usually correlates with the spike in COVID cases in our area. But hospital usage is still the same, which is good. We want to maintain routine care, of course. We don't want elective surgeries to be postponed. That's not something that we want. But unfortunately, if our blood supply doesn't increase quickly, that those conversations are going to have to be had. And so we're trying our hardest to avoid having to have those conversations.
Yeah, we want to avoid those conversations because it's hard, because what's happening is that COVID is affecting us in so many ways. COVID affects us because it delays care from other patients who get afraid to come in. We've seen the rise in the advanced staging of cancer from that, and heart attacks and strokes presenting at a later stage. We can't help them as much. And then it affects our patients because we can't bring them in. I myself have 3 of my CF lung transplant patients who we couldn't bring to KU. And they're in the smaller regional hospitals. And it's not that those aren't good folks. They're good folks. The problem is that this is where the expertise is in those diseases. So, because we have so many beds that have taken over by COVID, we don't have beds to accept transfer center patients. And so that's hurt our care. And then when you don't have enough blood supply, you can't take care of the really critically ill or the trauma patients and folks who come in, and the transplant patients, the bone marrow patients. I mean, you need the blood supply. And so every one of our aspects of care has been disrupted by COVID, and so we really need folks to not be fearful of giving blood, and we'll be thankful if you do give blood, because we need blood in order to help keep people alive.
Well, and Chelsea had mentioned, you all have been adjusting and getting used to it. We don't want people to think we're getting too used to it, but are we just finding ways to make it work? And
yeah, I think every day we find a way, but the problem is, and Amanda could chime in here, we do it, but you compromise some other aspect of your operation, right? It's not, we don't do things the same way. We used to take 70% of all transfer center requests. And now we're down to 25 or 30%. I mean, it's really reduced. And the problem is there are patients on the underline of that call who can't get care. And it's gone from an average of, 20 minutes to find a bed to transfer somebody to sometimes 4 to 6 hours. Well, that's a delay in care. And you may be sending that patient way away in order to find a bed, which is away from their family and friends and the people who can support them.
Yeah, and I think you've mentioned this before on the show, the time-critical diagnoses, 4 to 6 hours can make a significant difference when you're needing treatment within 60 to 90 minutes for evidence-based practice.
Yeah.
hey, Chelsea, just remind us and tell us all the info we need to know if somebody wants to come down and either donate blood or maybe even set up a blood donation drive.
Yeah, so I would suggest going to our website. All of our information is there. It's at savealifenow.org, or you can give a call. The number on the screen is there. You can make an appointment at any of our 7 neighborhood donor centers or blood drives out in our community. So we strongly urge you to make an immediate appointment if you're eligible to donate.
Okay, thanks so much. Stick around because we'll have some questions for you, I'm sure, coming up. Hello, Amanda Kackler. How are you?
Good morning. I'm
Welcome.
doing well, thank you.
We said you actually have other duties that you have to tend to. So
Sometimes, yeah.
Sometimes you do. You can't just pop in all the time.
Like telling us how many COVID patients we have every day.
Yeah, every day. And it's harder and takes longer to figure that out when we've got the number that we do. Mm-hmm.
Yeah.
All right, so we did bring you in here to talk a little bit about Labor Day.
Perfect.
Staying safe. I know people want to think that life is getting back to normal. Not so much. So just tell us a couple questions. If we spend time with people that we don't live with, so if we're with people we don't live with and we want them inside our house, is there a good way to stay safe?
Yeah, so, and I know this has been covered many times on the show, outdoor activities are obviously more safe than the indoor activities. We know now the CDC guidance suggests that in indoor settings, especially with folks who don't typically live in your household, masks are recommended. So if you can continue to wear your masks, Dana has mentioned this before multiple times, the further apart you can be, especially if you're not wearing a mask, increasing the distance between one another. And that's really in indoor settings, whether you're in a vaccinated setting or not. But obviously you're going to be safer if other folks within the indoor setting are vaccinated. But the recommendation right now is the same principles as always. Wear your mask. Don't go around other folks if you're ill. Keep your distance, and then if at all possible, hang out outside.
I know, you are a stickler for those rules. You always have been. So how does it look different from Labor Day last year to this year now with Delta?
I don't know that it looks significantly
not at all.
different.
I don't know. Is it worse? Is it?
You know, what's different this year, I'm trying to think back to what the traveling guidelines were last year, but
They were
the
more
CDC
restrictive.
just suggested if you're not vaccinated, you really shouldn't be traveling.
Mm-hmm.
And I think that's a big difference, especially for the
I
unvaccinated.
think the rate of disease transmission in the community is actually higher now than it was last year.
I agree.
I think it's worse, and I think the Delta variant's different. And so, Hawkeye, I think actually the rules of infection control are more important today than they were a year ago.
Yeah, I completely agree. I mean, we need to keep everybody safe and out of the hospital. We know that there is a large population still that cannot get vaccinated. That's the children. And we know with school being resumed, there are some schools that have had to shut down. There are some classrooms that have had to quarantine and shut down over the last couple weeks. So I think it's important for those kids to be in school because we've heard how important it is for those kids not to be isolated and continue to be in school and get those benefits of being in school. So it's important to take that into consideration as well, being able to keep your child in school and in those participation. And so really trying to reduce the risk of spread of the disease is extremely important.
So what if you're vaccinated and you're traveling? Should you be doing your research and finding out what the vaccination rates are in the areas that you're traveling to?
I think it's. I mean,
Or just assume everyone's
you can do
unvaccinated.
that, but like I was looking at the CDC has the community transmission tracker. It also includes the information for the vaccine status in those in the region. You can search by county if you want to. Unfortunately, high transmission is everywhere.
Yeah.
So it really probably doesn't. It's probably not worth it to do your research because I think the assumption is that it's high transmission everywhere. Delta is absolutely different than it was the variant that we were dealing with last year. So I would just take the principles of infection prevention with you wherever you go.
They travel with you wherever they go, and they keep you safe. Yesterday, today, and tomorrow.
I love it. Okay, I do have a reporter question from Clay with the Kansas Reflector. Okay, so he wants to know is, now that we're seeing over-the-counter COVID antigen tests, which allow folks to check themselves at home, what are your thoughts on these kinds of tests? Should folks consider using them? How accurate are they?
I think they're accurate if they're positive, and I think you don't know if they're negative.
Exactly. I think that's it. Is it worth doing one to confirm you're positive? Yes, but then what does it mean if it's negative? It doesn't mean you should stop wearing your mask, keeping your distance, keeping your principles of infection prevention.
Yeah, I think for those home tests, what we've seen with antigen tests, including influenza tests, is that when the disease spread is more prevalent in a community, those tests seem to be more accurate. So if there is a positive, you can absolutely believe that it's a positive. If you are symptomatic and it's a negative, then you probably want to go get a confirmatory PCR. But also, there are other cough and cold viruses going around as well. But I think best practice would be, if you want to do a home test, I think that's great. If it's positive, you absolutely have to consider that a positive. But if it's negative and you are symptomatic, and if other people you know are symptomatic, then I think it's important to get that confirmatory PCR as well.
All right, Clay has another question. With schools starting up across the country, what is the role of testing in schools, particularly those 5 to 11 who can't be vaccinated? Just talk about the mask, the distancing, and just the importance of like ventilation in the schools. What can we say about that?
Well, I think testing is another kind of tool in our toolkit. We know masking is probably the most important, the staying home if you're sick, the great hand hygiene practices in those settings. But I do think that testing, and I know there's been some CDC guidance on this in some schools that they're doing testing, especially for if employees haven't been vaccinated in those settings, that requiring those tests. So again, just another mechanism to try and monitor what's going on within that population and try to reduce transmission to the degree possible.
Can I just point out too, just I think that's a really important point, and I think if you step back and say to us, remember we didn't have a lot of people vaccinated, and we were down to 2 patients in March.
That was easy to do, the inpatient census email.
Was it? No, yeah, that didn't take much time, and it was great.
It's easy.
And we were all joyful, and we could kind of get work life back to normal, and the ORs were humming and all that. It was great. What was different?
The masking mandate went away.
Yeah,
absolutely.
As soon as we open everything up, here comes the Delta variant, and it was a combination of 3 things.
Yeah.
There weren't that many vaccinated people. People quit wearing their mask, and here comes Delta.
Yeah.
And that was the eye of a perfect storm. And what we have to recognize is that now nobody wants to go back to masking. Now, Kansas City's numbers are down, That's great. Why is that? Well, it's not that we got that many more people vaccinated. I think more people are masked. And they're masked and the behaviors are overall better. I will just challenge and say, I think Johnson County needs to have a mask mandate. I'm sorry, I'll probably make some people mad. But the reality is the reality. If you want to get this under control and reduce the burden on each other and reduce the risk of disease transmission, you have to mask. And I think the other thing that has happened, and the other thing that's really has protected us from even a worse outbreak of the Delta, is all the vaccinations in nursing homes, which has reduced the disease burden of people from nursing homes. And that has been a really important point. We don't talk about that enough. Does vaccination work? Well, heck yes, it works. Look at how much better we are with nursing homes this time around.
I'm going to make a quick comment because you were talking about the burden on hospitals earlier, and you mentioned the eye of the storm. And I received a document yesterday suggesting if they needed to displace hospitalized patients due to Hurricane Ida, the ability of the United States to support that is much diminished whenever we're all full with COVID beds. So whenever you have a natural disaster, and typically part of our emergency management program within healthcare is that you do support those other organizations. I mean, that just adds to an already very overburdened hospital situation that I don't know what we would be able to do.
You know, and there's a it just feels like we're in a slow motion crisis, right? You look at climate change and you look at things like the wildfires and hurricanes and tornadoes and torrential rain, severe drought. Yeah, this is a tough time. You couple that with the virus, you wonder if there's a relationship between those. I don't know, I'm not smart enough to know. But you look at that and think, God, this is a tough time. And then you look at some of the divisiveness in the country and like, we're even having a hard time having a good conversation about it. And so I think one of the things we try to do on this program, Jess, is we try to have an honest, good conversation about stuff and tell you guys, this is how we think it is. But we also try to find hope, right? Because you don't want today to be forever, and you don't want tomorrow to look like yesterday. So how do you change that? And the answer is we find hope in trying to take care of each other. That's always where we find hope. And if we can help take care of each other, then that hope grows stronger. So taking care of patients out of Hurricane Ida, trying to wear a mask to make sure we take care of each other, trying to make sure kids stay in school because they are masked. You know, there was a report this morning about a school in Macon, Georgia, going on a 2-week, they had to shut down the schools for 2 weeks because they had such a severe outbreak. You know, if you just wear a mask, you won't have the outbreak. We've proven that again and again. So, you know, you can find hope, and hope will help then find you and find others. So the way to find hope is to do the things that we know, take care of each other. And you know, it's just the stuff you know is the right thing to do. So if we can figure out a way to just stick to what we know is the right thing to do, by taking care of each other, then we can find the hope we need to help sustain us.
We've got some good community questions coming in. So, Dr. Stites, I'm just going to jump in with Rebecca, just as you talk about hope. She asked, when will this thing quit mutating? Or how close are we from vaccines, or how close away are we from vaccines not working?
No, those are two great questions. So first of all, I don't think it's going to stop mutating because we have so many unvaccinated people in the world, and it can find that anywhere we go. And there's even some reports now coming out of, it's Japan this morning, I think, where they're discovering a new variant called the Mu variant, which may be more vaccine resistant. So some concerns about that. Don't know anything about its transmissibility yet. It's very early in its study. But those are the things that really would scare us because of the vaccine resistance potentially that can develop. I mean, the Delta variant doesn't really appear to be vaccine resistant. You may have a higher incidence of disease transmission with the Delta variant than you did with the Alpha variant, the original strain, but you are protected against severe injury and death. So I think what we are most afraid of is that we will see a rise of a highly transmissible variant that will overcome the protection against disease transmission and death. And I think that's what we don't want. How do we prevent that? Well, you prevent it by not allowing it to spread from one person or another, and there's three major vehicles really for that: distancing, masking, and vaccination. Again, we proved in March that it works, right? We were down to 2 patients. Hallelujah, we'll manage 2 COVID patients here any day. But when you're managing 100 or today 93, which is coming down from 107, which I like, it's harder. So I think, when will it end? I think COVID-19 is here for a very long time. I think because there's so many unvaccinated patients across the globe, and there is so much of a disease transmission already, that the hope that we're going to be able to end the pandemic is diminished. I think what we can do is we can manage the pandemic, and we've proven we can do that, Hawkeye.
Yeah, I agree. I think this is one more point, along with many, many others, that lead to the fact that this was not a laboratory engineered virus. We have seen the transition of this virus since the initial Wuhan strain, the ancestral strain, until now, because this virus continues to evolve once it has now got it into the human population and has spread so far and wide. And so I think, if this were really constructed in a lab, all of those experiments would have been done, and we wouldn't be seeing the evolution that we're seeing. But it is actively evolving because just in the replication process itself, it is very error prone, so it is making those mistakes, and some of those mistakes are advantageous, creating it to be more fit. So we have what we have now, Delta variant. I think we are going to continue to see variants arise. Now we need to keep identifying them and monitoring them, but right now, as Dr. Stites talked about really early on in the show, all of our vaccines continue to provide very good efficacy against hospitalization, severe disease, and death, the worst cases of the infection. So that's what we are really wanting and needing from our vaccines. Would there be a point at some time that the vaccines lose efficacy? Yes, but what we do see is throughout all the variants, and thanks to the vaccines, we have very good cross coverage for all the variants that have arisen, even with these vaccines, which were all created based on those ancestral strains of spike from the original Wuhan strain. So, will it happen? It possibly could, but right now we seem to have really continued good protection from all of our vaccines, and I think this would be a good question for our guest tomorrow as well.
And I would just say, Hawkeye, that the other key is that with those messenger RNA vaccines especially can pivot so fast that even if another strain comes up, the ability to pivot is strong.
All right, Chelsea, get ready because I've got a few questions coming in for you. But in the meantime, Jean wants to know, are there any fully vaccinated people in the ICU or on a ventilator right now?
We've had some like that, but they're, Amanda, when I looked at them, they're almost all really immunosuppressed, like transplants and cancer chemotherapy active.
Yeah, and I was, I think I made a comment this morning when I sent, because we did have I want to say mid 20% of our COVID positive folks are vaccinated, but many of them are overdue for their third dose, which suggests that they're in that immunocompromised state. So they're, and it's very common that I'm looking through them, they have significant cardiac disease. They've, their list of comorbidities is, you have to scroll down. There's so many of them. Several of them are active cancer patients or have had recent transplant. Their underlying health conditions are probably what have brought them in, and they are also COVID positive.
And one would wonder, and I think that's a really important point. Are they here from COVID? Are they here from their underlying condition, or that combination? And the answer is usually probably the combination, because patients with that long of a disease list, any virus, you can get RSV, you can get rhinovirus, you can get the common cold, you can get the flu bug. It's like a nausea, vomiting flu bug. And those little things take somebody who's just barely compensated on a daily basis, and it pushes them over the edge, and they come in the hospital.
Yeah, and it's hard to discern looking at their medical record. Is there shortness of breath related to their underlying cardiac disease? They've got fluid overload because of their congestive heart failure. They've got a restrictive lung disease underlying, and then you put a respiratory virus in the mix. It is extremely difficult to discern. Is it COVID, or is it they need their underlying condition being treated?
And the answer is, and this has been ongoing, but this has been happening for years. This is not new, and so. But what you figure out is that, and I say it every day in my patient population, if you hadn't gotten the virus, you wouldn't be here. Your other diseases are what force you in, because you need support of all those diseases you have. But if you hadn't gotten sick, you would have been staying at home. And I think that's the key message. I think you're right. The other point is that did folks who really have severe disease, Hawkeye, do they really ever get a good viral response? Because like the transplant patient data suggests, they didn't really have a good response after 2 doses.
Yeah, you're exactly right. So I think that is the important point, and hopefully the third doses will give them good responses. But even then, what is that full response? But certainly we have seen more of that. With that third dose, they have a better response, better protection than with that second dose. And again, very good data. Now we are looking at other populations as well for additional dosing of the mRNA vaccines, and hopefully we'll hear more somewhat later in the month.
Dr. Stites, I have one more question for you. It's 8:30. You need to go, right?
I do have to run.
Okay,
I'm
but I'm
sorry.
going to ask Sandy's question, and then we're going to
Okay.
keep going with questions because we have several for our guests today. But Sandy wants to know, what is the definition of long haul? My father-in-law got out of the hospital, not vaccinated. I don't know if that has anything to do with it, but got out a week ago, Tuesday, but still tired. So when does it go from, when does the healing stop, and then you go into like the long haul phase?
I think Hawkeye's probably better positioned to answer this question than I am. I think there's a pretty strict working definition now. What's a long haul syndrome?
Yeah, typically you need to continue to have symptoms for 12 weeks after that acute infection period. So it is quite a long time. You know, we don't accept anybody in our long haul clinic until about 12 weeks after their acute symptoms. Hopefully within that time your symptoms would resolve, but if they don't, you know, we have our multidisciplinary long haul clinic here to help ease you through that and get better as much as possible. We know that people continue to have decreased quality of life and symptoms that can persist, and that's why we have instituted our multidisciplinary clinic to help you get through that.
And I just want to point out that the key is that you may have maybe fatigue, it may be the brain fog, it may be shortness of breath, it may be muscle soreness. I mean, those are the things that really get people into this long haul story. And the answer to the long haul thing is, A, make sure you're vaccinated, because it reduces the risk of it, both because you reduce the risk of severe disease and you reduce the risk of long haul, and you may even treat long haul. So vaccination is once again the answer. And I'm going to have to pop out. I apologize for that. I have to go take care of a couple of patients. I just want to say one final thought.
Please do.
Before my early final thought is,
You bet.
you can always find hope. And remember what we said right from the beginning of the show. There's still no place like home. I'll see you guys back. I'll be
Okay,
back
you'll be back
tomorrow.
tomorrow, though.
I'm back.
All right. All right, so guys, we can handle this.
I think so.
All right. Okay, so Chelsea, I got to bring you in because we've got a bunch of questions coming in for you. So let's just get to those. So Ashley says, giving blood wipes me out for the rest of the day, sometimes the following day. Is there anything I can do to help prepare myself? How much you drink, how much you eat, before she comes in and donates? What advice do you have for her?
Great question. So we always suggest that, especially if you're somebody who struggles to keep your iron levels up, maybe start taking an iron supplement a couple days or 3 days before your donation. The day before, you want to eat a really hearty meal, and then the day that you donate, make sure you eat a well-rounded breakfast, lunch, eat a meal within 1 to 2 hours before you come in and donate. Don't fast. Also, hydrate. So you want to be drinking lots of water before you come in, and then the night before your donation, get a good night's rest, and you should be good to go.
I'm usually good to go with the Nutter Butters afterwards and the Oreos. That usually helps me get right back. I get right back on track with those. You know that. So Rebecca wants to know, and maybe Amanda and Dr. Hawkinson can answer this. I'm curious what people do. Excuse me, wrong question. Okay. So Peg wants to know, is there a wait time after vaccination before I can donate blood?
There is not for the vaccines that are being currently distributed in the United States. So Moderna, Pfizer, Johnson & Johnson, if you receive those vaccines, there's no deferral as long as you are feeling healthy and well. You could get the vaccine and come in and donate same day. If you receive an attenuated vaccine such as AstraZeneca, which I don't believe is being widely distributed in the United States, that one would incur a 2-week deferral, but we don't have to worry about that one right now as far as I'm aware.
All right, Tam wants to know, does it matter if you donate to Community Blood Center versus the Red Cross regarding blood donations staying here local?
Yeah, that's a great question. So the Red Cross is actually a national blood center. So they supply blood across the country. They'll supply blood to military establishments sometimes. The Community Blood Center here in Kansas City is a local community-based blood center, which means all of our blood stays here to meet local needs first. So we will often reach out to our neighbors, help them out if they are low on blood products, or for example, with Hurricane Ida, we've been watching that pretty closely and are anticipating being asked to send blood down there because those blood centers are probably not able to collect in the capacity they have been collecting. So when natural disasters happen like that, we usually have a blood supply to be able to reach out and help them. Right now, we do not. So our blood will stay here locally for the most part because we need every drop we can to meet our local need first. So that's just the difference between us and the Red Cross. The Red Cross does collect here locally, but for Community Blood Center, we provide about 90% of the hospitals in our greater Kansas City area.
Isaac has a question similar to what you were just talking about, but he's wondering, do you expect to see an influx of donations when we have a natural disaster like Ida?
We usually do, yes. Historically, when hurricanes have hit or locally here with the Hyatt Bridge collapse, we'll see when a disaster like that happens, we'll usually see donors lined up out the door. That's not been the case with Ida, simply because we've not been asked to send blood down there yet. If we are, that will be something that we go to the public with and ask for help. Because like I said, our blood supply is very low, so we're going to need to see a significant increase in donations in order for us to supply blood there. But historically, yes, natural disasters like that usually do result in a spike in blood donations for centers in the area.
Okay, hang tight on that. Dr. Hawkinson, I do have a media question from Donna over at KMBC. Do you know if the 2 deaths yesterday were vaccinated?
The information I got was neither were vaccinated.
Okay. Let's get to a couple. So Rebecca wants to know, she's curious, what do people do if they need care? With hospitals so full, are you even guaranteed a bed if you need one?
I think that's a really good question, and really kind of gets back to the concept of doing your part to help the community by getting vaccinated and really try to reduce the burden on the hospitals. Right now, what I know we've discussed this multiple times as it relates to the transfer center, we haven't been able to guarantee patients a bed coming from other hospitals that need care here, and that is extremely difficult for us as an organization who provides great health care. So I think it is still something that if you are having symptoms and you need to seek medical attention, that you absolutely get in connection with your primary care provider. If it requires emergency care, you go to the local emergency department, and everyone is doing their absolute best to get the care for you that you will need.
Okay, so Deborah says, I have been vaccinated and had COVID twice. Each time it was worse. Is it possible to not have any antibodies from either vaccine or from having COVID? And if so, am I at higher risk of getting COVID again?
So I guess I don't know. Have you had COVID twice after being vaccinated? I don't know if that, or you had COVID once and then got vaccinated, then had COVID again, or you had COVID twice and then got vaccinated. I don't. Either way, if you are not otherwise immunosuppressed, there's really no reason to think or expect that you wouldn't have either antibody response or T-cell responses. So unless do you have a history of other immunodeficiency or for something for that reason? But otherwise, there's probably no reason to expect that you wouldn't have antibodies or T-cell responses. And again, without knowing further medical history, can't really answer anything more than that.
All right, Kim wants to know, I have lymphoma cancer. Just wondering if I can donate blood. My blood work came back clear as of August 31st.
So if you've had cancer and you're not currently in full remission, you would be deferred from donating blood. However, the FDA did release some recent updates surrounding deferrals that have to do with cancer patients. So typically, we require a 3 to 5 year remission period before you're able to come in and donate, but it does depend on the type of cancer. I would suggest that you go online. Give us a call. We have a medical eligibility hotline online. Give us a call so that we can ask you some more questions about your cancer, any current treatment you might be on, things like that, and we can give you a better answer there.
Elena has a question. She wants to know if there are any weight restrictions for donating blood. She doesn't think she weighs enough.
Yeah, in general, it's about 110 pounds. So there's going to be a population of people who don't quite qualify for that, but 110 is the all-around limit.
Sherry wants to know, are insurance companies covering hospitalized COVID patients who are not vaccinated? Can we answer that? Do we know?
I don't think that there's any restrictions right now from insurance companies.
Yeah.
Deb wants to know, how can we get vaccines to other people around the world? Any insight into that?
Yeah, I think a lot of this has to do with the federal government. I know that we have tried to be able to donate some of our vaccines that were going to expire. There are explicit laws and regulations about vaccines that have been distributed to the states. So a lot of the donation of vaccine or the sending of vaccine to other countries really is done at the federal government level rather than at the state level or institution level.
All right, I'm going to give the last question. It's from Melanie, and it's to Chelsea. What is involved with setting up a blood drive? As far as facility use, any volunteers required, funding, what does she need to keep in mind if she wants to set one of these up?
Great question. So we actually have a need for blood drives. So if you've got a space, we usually, now in COVID, we require some social distancing. So we ask for a space of about 2,000 square feet or greater. And then if you've got a population of donors or of individuals that you can invite to donate, so friends, family, coworkers, members of your church or community organizations, if you have that, you have the space, you have the people, you can set up a blood drive with us. So it's pretty simple. We do a lot of the legwork to help you get the word out. And then on your end, you just book that space for us and help spread the word to your donor base.
And Chelsea, do they just call that number that was up on the screen or visit the website? How do they find you?
Yeah, absolutely. You can call that number, or there's a specific page on our website for hosting a blood drive if you want to find some more detailed information there and fill out a contact form, and we can get in touch with you that way.
All right, we're going to get to our final thoughts. And Chelsea, I'm just going to stay with you right now. Just what's your final plea to the community about our lack of blood donations and our need at our community hospitals?
I think final words from me would be that we understand the concern, especially as cases are so high. We understand there's a lot of fatigue. I think COVID fatigue happening in our community right now, and this might not be a message that you want to hear, but when COVID cases are spiked like this and our hospital systems are a bit overrun, having a robust and available blood supply is critical, and we don't have that right now. So donating blood is something very easy that you can do. It takes only an hour. We ask that if you have questions about whether or not you're even eligible, please give us a call. Don't self-defer. Give us a call. Let us have a conversation with you about it, and hopefully we'll see you soon at a donor center or blood drive.
Absolutely. And you're welcome back anytime to share your message. Chelsea, thank you so much. All right, Amanda, your message just in general, and certainly as we head into this holiday weekend.
Yeah, it's weird to be here on a Thursday. I'm usually here on a Friday. So heading early into the weekend, I think there's an indoor activity I would recommend, and that is going to get vaccinated. I suppose the other indoor activity would be to go and give blood. And then otherwise, keep doing what you're doing with infection prevention and control practices. Hopefully the weather will cooperate. I think there's supposed to be some rain on Friday and Saturday, but Sunday and Monday look like they're supposed to be nice, at least around here. So get outside and stay safe.
Do what you did a year ago.
That's right.
Very simple.
Yeah.
That's right. All right, Amanda, always good to have you. Come back on a Friday. Help us answer all these questions. We appreciate
Anytime.
you. Dr. Hawkins, and final thoughts from you.
I would agree with Amanda. Stay safe. Please get vaccinated. We have more data signaled out to help encourage vaccination, and that is the reduction in long haul symptoms. So please, we have plenty of vaccines available. Come out and get them.
All right. Well, thank you all for being with us today. We know there is a lot of misinformation about COVID online. We see it daily on social media from people who are not medical professionals or experts or scientists. So tomorrow, we are joined by the host of This Week in Virology. It's a podcast to help put some of those rumors to rest. So we're going to see you tomorrow at 8 o'clock with that. But we are going to leave you with this video. Dr. Chad Cannon walks us through what it's like inside the emergency department right now. Because as we know, Delta is different.
We have about 55 beds in our ER. Typically, we would maybe only have half our beds full, and as the day goes along, the patients come in, the beds fill up. But we're starting off with our beds already full. Often, patients are waiting in the waiting room for several hours. Once a patient is treated by the physicians and seen and determine their cause, if they need to be admitted, then they often will then have to wait several more hours, sometimes up to 6 to 10 more hours to be admitted to the hospital bed. Some patients, when there's no beds available at all, are waiting over a day in the hospital, in the ED to be hospitalized.
The hallway hallway beds are a real thing in all the hospital EDs across the region. We call it wall time, which is the time that the EMS crew has to sit on the wall with their patient on the EMS cot before we can find a bed. And there are places around the country and in the Midwest that have hours of wall time where the EMS crew brings the patient in and they sit on the cot for hours because they can't find a bed. So the ambulance crew is put in a continual conundrum of trying to explain to the patient, we understand you broke your hip, you want to go to the healthcare provider that you have chosen, but the consequence of that is you might be sitting in the waiting room or you might be sitting on a bed in the hallway for a long period of time because they're overwhelmed. And we have to have those awkward discussions driving down I-35 or 69 highway with a patient who's having chest pain.
What's really contributing to this problem is folks not getting vaccinated. I looked at our hours of when we're on high volume of diversion and the curves of how many hours in our city that is going on. It actually mirrors the surge of COVID. And you could lay those two graphs on top of each other and they're the same exact shape. So we need time to catch up, and if folks get vaccinated, the curve will bend and come down. Our EMS volumes will go down and we can get back to taking care of patients, and EMS can get back to doing their job, and I think we're going to be in a better place.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.